All right, how's everyone doing? This is Dr. Chapman from Chapman WellCare, and in today's video, we're going to talk about cranberry juice and UTIs. This is something that we hear all the time from patients, so I wanted to dig into the research a little bit and actually investigate. Is it real? Does it work? What's the science behind it? So let's talk about that a little bit. So UTIs, or urinary tract infections, are extremely common. Very common in women. They are something that we see in the primary care setting all the time, whether you're in the ER, in urgent care, in a doctor's office. This is something that comes up all the time. And many people across the globe are placed on antibiotics for urinary tract infections. And oftentimes you'll hear patients say, I'm taking cranberry juice, I'm taking cranberry tablets, I'm drinking cranberry juice. So let's go into the science as to why this may or may not work. So again, UTIs are when bacteria ascends into the bladder and attaches to the bladder wall. And that causes pain, spasms of the bladder. It can cause color change, blood in the urine. And this is oftentimes when patients will be placed on an antibiotic. And the most common bacteria that invades the bladder wall is E. coli. And any bacteria is a single-celled organism, and bacteria has little hair-like fibers on the outside called fimbriae, and these are little hair-like structures that allow the bacteria to attach to parts of our body, and in this case, the inner lining of the bladder wall, what's called uroepithelial cells. So it's these fimbriae that help attach or let the bacteria invade and start the infectious process. And lab research shows that cranberries have a chemical in them called PACs, or what's called proanthocyanidins. And lab research for many decades actually has shown that these PACs block the hair-like structures from attaching to the inner lining of the bladder wall. So there's actually been a lot of research into this, and the overall consensus is, since cranberry supplements or cranberry juice is benign treatment, that it's actually recommended in some females who are prone to get recurrent multiple UTIs. And you can drink cranberry juice, you can take tablets. Some people say tablets would be better in that you're not ingesting extra calories or extra sugar, but this is actually something that's been put into a Cochrane review. And just to give you an idea, different studies have different levels of validity. And a Cochrane review basically takes all the studies about a topic and has compiled it into a conglomerate and tries to analyze that information. How did one study match up with another? And they actually added 26 studies over the past few years that looked at the science behind cranberry juice and different subpopulations. And it's actually recommended that if you are a female who gets recurrent UTIs, that cranberry supplementation may in fact help. I'll be honest with you, this is something that I didn't know, going into the medical field, whether this was a kind of a medical wives' tale or not. So it's something that I had interest in trying to kind of investigate. So it's something that may work, it's something that may help. It certainly doesn't harm the patient, but it's not something that may work in all populations. If someone has anatomical issues with the bladder, if patients are very elderly, if there's other organisms behind the, apart from E. coli, then it may not play a substantial role. But there's definitely science behind it, and there's definitely over 26 studies that were scrutinized by the Cochrane review that shows a potential benefit. So hopefully that helps. That's the science behind cranberry juice and urinary tract infections. Thank you very much. Have a good day.